I am Misty Okada. I'm a lactation consultant for the Women's Center at ERMAC, and I'm talking to you today about low milk supply. All moms start making colostrum during pregnancy. Colostrum is the perfect food in the perfect size quantity for newborns. They eat small amounts frequently, so 8 to 12 times a day, about a teaspoon to a tablespoon per feeding. So as long as baby's getting that amount in the first few days, we know baby's getting enough. There are many reasons that contribute to low milk supply. Most of them are preventable. Milk supply works on a demand and supply system. So you need to demand your body to make that milk supply. Feeding formula in the first few days creates missed feedings, and those missed feedings tell your body to not make more milk. Using a pacifier too early, we recommend waiting 3 weeks at least to use a pacifier. Those create missed feedings and can contribute to low milk supply. Having baby sleep through the night and encouraging baby to sleep through the night, or not waking them up during the night to feed, you miss feedings. Not latching deeply so that baby doesn't transfer milk well will also create milk supply, because you're not emptying your breasts, so your breasts are not making more milk to replace it. So at your 6-week postpartum visit with your doctor, you'll be talking about birth control. It's very important that your obstetrician understands that you are breastfeeding so that you can choose a birth control method that is low in estrogen and higher in progesterone. So the mini pill, the Depo-Provera, the Mirena IUD are all good choices to make because they won't affect your breast milk. Cold and allergy medicine that has pseudoephedrine has been shown to decrease milk supply. So if you need a cold medicine or an allergy medicine, just look for a type that does not have pseudoephedrine. Babies born that are tongue-tied have problems with transferring milk well and latching deeply. If you're concerned about slow weight gain, please talk to your pediatrician about having that assessed and seeing if they can release the tongue so that it can latch deeper. Insufficient glandular tissue is rare for moms, but can be caused by a few genetic or medical conditions. One indication that this may be true for you is if you don't notice any breast changes during your pregnancy. Most moms see a cup size or so in increase during their pregnancy, and if you notice no breast changes, this may be the cause for you. Best way to know how much is going into your baby is how much comes out of your baby. So 6 to 8 wet diapers per day and 2 to 3 poops is what you should expect for your baby in the first few days. We expect babies to lose weight in the first few days. By 2 weeks, they should have regained their birth weight. After that point, they should gain 4 to 7 ounces per week, and that can be checked at their pediatrician's office. The best way to increase your milk supply is to breastfeed. So increase breastfeeding, and you can increase pumping after each breastfeeding to add more demand to make more supply. Another way is with foods and herbs that can increase milk supply and work with about 50% of women. Oatmeal and high fiber foods can also help with increasing your breast milk supply. There are lots of recipes on Pinterest for lactation cookies and smoothies that include oatmeal, flax seeds, and lots of high fiber foods in them. Herbs that are commonly used to increase milk supply include fenugreek, blessed thistle, malunggay, brewer's yeast, mother's milk tea, which is a combination of blessed thistle and fenugreek. These can all be used to increase your milk supply. Most importantly, nothing replaces time at the breast. As a lactation consultant, my #1 piece of advice is to trust your body. Not all women are the same, and not all experiences are the same. Some may get engorged in the first few weeks, some may not. Some may have oversupply in the first few weeks, some may not. Some may have a sensation of letdown, and some may not. We know that almost all babies have fussy times. We know that all babies go through growth spurts and seem to do nothing but eat. This is not a sign that you don't have a good milk supply. If you have any questions or concerns, please call us at our lactation department at 529-7171 or talk to your pediatrician.